Hey everyone, Dr. Laura Schwint here, and I am on today to talk to you about an apple a day and your toothbrush, how you can smile your way to a healthy immune system. So I'm going to move this so it's not in the way and we can get started. All right, so start brushing and flossing. This is your at-home immune system tune-up. And we all know that our health is one of the most important things that you own. Now, and I think this is a really good point. You own your health, and it's a precious commodity. And so cultivating a robust immune system is one of the best ways that you can promote good health, but also happiness and a balanced life. We are all vulnerable to viruses and bacteria. None of us can live in a bubble, and so we are exposed to viruses and bacteria all the time. But when your body's defenses are weak or depleted, you are at a higher risk. And so there are some extremely simple things that you can do to give your immune system a tune-up right at home. And so this is your prescription for an at-home immune system tune-up. We all know these things. These are basic things. They don't cost a lot of money, and we can all have access and do them. So number one, getting enough good quality sleep. Making sure you're moving your body with exercise every day. Promoting excellent gut health with a diet full of plants and fiber. And then making sure you're taking time every day to be mindful with meditation or praying. And finally, getting outside in nature. Breathe your biome, get some sunshine. But did you know that there's one other super simple self-care tip that can have a profound effect on your immune defenses and your overall health? And it's very simple: taking care of your smile. So a lot of us think that it's somewhat normal to have a little blood in the sink after we brush or floss, but this is not normal. And bleeding gums is a sign of inflammation. And this type of inflammation is a chronic low-grade inflammation, and it puts a huge strain on your immune system, which then leaves you more susceptible to viruses and bacteria. So there is a synergistic relationship between your oral health and your overall health. Chronic inflammation and gum disease are linked to a whole host of other major health problems, such as heart disease, diabetes, stroke, rheumatoid arthritis, respiratory infections, Alzheimer's, and early and low birth weights in pregnant women. All of these things putting us at higher risks to viruses and bacteria as well. And so there's a few truths about plaque that some people may or may not know. Basically, we all have bacteria in our mouth, and when we eat, we feed these bacteria. And plaque is a sticky film of bacteria that constantly forms on your teeth. These bacteria in the plaque feast on the food that we eat and digest it, and then they excrete, and I mean, yes, they poop and pee acidic waste into our mouth. This waste products are what lead to bad breath and tooth decay. But what's more dangerous is plaque that gets left on teeth longer than 48 hours, calcifies and turns into tartar. This tartar is impossible to remove with your toothbrush or your floss. And the scary part about this is your mouth interprets tartar like a foreign object and sets off a huge inflammatory reaction. And this activates the immune response, which creates chronic inflammation, and then can eventually start damaging healthy cells, tissues, and even organs. So your mouth is the entry point not only to your digestive system, but to your respiratory system as well. And by brushing and flossing regularly, you're not just preventing cavities, but you're lowering the number of immune damaging bacteria in your mouth as well. So it's really critical that we brush the plaque away before it turns into tartar to prevent inflammation. So here are a few tips to get the most out of your brushing habit. You should brush twice a day and make sure that you do a very thorough job at least once a day. Remember that 48-hour rule. So if you can do an extremely thorough job at least once a day, preferably before bed would be ideal. Brushing for 2 minutes, making sure to clean all surfaces of your teeth. And so there's fronts, there's backs, there's tongue side, cheek side, tooth chewing side, making sure you're getting all the surfaces. Using a soft bristled toothbrush or investing in an electric toothbrush that does an even superior job. And then making sure to replace your toothbrush at least every 3 months, or after you've been sick, or if the bristles are flattened or splayed. And then you want to use gentle pressure with a circular motion, not back and forth. Back and forth tends to miss spots on your tooth, and the gentle pressure you want to make sure and have so that you're not damaging your gums. And then do not brush immediately after consuming acidic foods, because what this actually can do is brush that acid into your enamel, and that can cause damage. All right, and then most people think about floss as something sort of extra that they maybe don't need to do, but it's so critical because 40% of your tooth surface is between your teeth. And this is an area that your toothbrush will miss 100% of the time. I actually tell my patients that if you brush but don't floss, it's like taking a shower and not scrubbing under your armpits. Ew, why would you not clean that area? And it's the same in your mouth. You're missing a big portion of area to clean if you skip the floss. All right, so tips for fantastic flossing. You want to slowly guide the floss between your teeth with a gentle back and forth motion. Once you've moved the floss past the point where the two teeth contact, you want to curve it into a C shape against one tooth, almost like it's hugging the tooth, and then gently slide it in the space between the gum and the tooth. It actually goes below the the gum surface a little bit. You want to try to avoid snapping the floss between the teeth. This hurts and can damage gums, and really is probably the main reason most people don't like to floss. All right, floss picks are super trendy, and they are an alternative to traditional flossing. It's better than not flossing at all. However, they're not as effective as conventional floss for two reasons. One, floss picks only move in up and down motion, and they don't hug the tooth. They don't form that C shape around the tooth. So there is a lot of tooth surface that's left untouched. And then using the same pick on all the teeth can actually spread bacteria from one area in the mouth to another area. And that's kind of gross. All right, so brushing up your home hygiene routine. This is one of the most simple, impactful ways you can help your body stay in shape and defend yourself from harmful bacteria and viruses. It's also super economical, and it is something that benefits you and others with your beautiful smile and fresh breath. So I hope that you will take your brushing routine to the next level and help your immune system stay healthy. All right, thanks everyone.